So now how do we fill the front page? So the front page, write name. This name is for patient. If it's an examination situation, you always have student's index number at the top where you fill your index number. But here is for the patient. Inpatient number, age, please age. If it's in years, write years. If it's in months, write months. Male or female for sex, write in full, male or female. Occupation, if it's nursing, write nursing. If the patient is a trader, write trading. If the patient is a teacher, write teaching. The patient's surgeon or physician's name you write. Date of admission you write. Once patient is on the ward, there is a date of admission, so it should be written. The name of the ward, patient's bed number. Religion, Christianity, Islamic religion, traditional religion. Because I'm in Ghana, I'm using 3 of them. Next, this is the diagnosis, medical diagnosis for the patient. You write. Once patient is admitted, there's a diagnosis. Even if it's not confirmed, there's a queried diagnosis. Write and write queried, the question mark. Operation. If patient has undergone any surgery, you write. If patient has not done one yet, but patient will go, write none done yet. If patient condition doesn't require operation, write not applicable or NA. And this is the date of discharge, if the patient's discharge. If not yet discharged, write not yet. Some people also write not applicable. Please note that this place is 1 mark. But with the 1 mark, if you don't write diagnosis, half will be gone. If you don't write patient's name, half will be gone. These 2 are very necessary, depending on your examiner too. Someone, if you don't write the name or the 1 mark, you will lose it, because if you cannot identify the patient, you can't even solve any problem. Yes, so diagnosis and name is very necessary. Everything else is necessary, but these 2 must be there. And patient problems, so you line them: problem 1, problem 2, problem 3, problem 4. One thing you should know is that problem 1 should have a correspondence of strength 1. So what is wrong with patient that you stated first? You should write the strength here. The strength is what patient has or can do to help you solve the problem. As I said, problem 1, when you get it, you come and write strength 1. Problem 2, you come and write strength 2. So you should have 4 problems here, 4 strengths here. And the allergies, please, if patient doesn't have any allergy, you write no known allergy. It means the allergy is not known yet, because allergies are such that unless you come into contact with it, you won't know it's your allergy. So allergies, no known allergy. That language too, we don't change it. And if there are allergies, then you number and write them. Number, if there are 2, you write the 2. Patient is allergic to perfume. Patient is allergic to dust. Or you can just write perfume, dust, pollen grains. But that is if there are many, you number and write. If it is no known allergy, please don't number 1, 2, 3, 4 and write no known allergy 4 times. If it's not known, it's just once that is not known, so it should be there. So routine cares, we have TPR. Usually we write according to frequency. So monitored 4 hourly, monitored 5 hourly, monitored 2 hourly. BP2 the same. Please note that on the real care plan sheet, there is diet before the fluids, where you write normal diet if patient is not on any dietary restrictions. If patient's diet is salt restricted, you write salt restricted. If it is fat restricted, you write fat restricted. If it is meat restricted, you write. Or if patient is on nail per os, write nail per os. That is, patient is not supposed to take anything by mouth. Please note, because it doesn't appear on this sheet. Fluids, if patient is not on early fluid restriction, then it is liberal. If patient is on fluid restriction, then you write restricted, or you write nil per os if patient is not taking anything by mouth, or you write restricted to IV fluid. Then intake and output, you can write monitored and balanced over 24 hours. In oral hygiene, maintained twice daily with toothpaste and toothbrush if there is enough time. If you don't have enough time, then you just write maintain twice daily is accepted. Bath, maintain twice daily or once daily, depending on what the patient tells you or what you identify with patient. Urine testing. Usually patients on admission, we do urine testing when patients come to aid diagnosis. So if it's like that, you write down on admission. If you can't find where the urine testing is done, well, you can't find it in the folder, or you can't find it on the computer, then write not done. Body weight, if it is done, write done and can write value in bracket in kilograms. Activity, you can write that patient is ambulant, patient is confined to bed, patient is bedridden, patient can walk with assistance. All these ones are accepted depending on the patient's condition. 1 mark for this side, two marks for patient's problems. It means half per problem because they are 4. You are expected to write 4. 2 marks for patient strength, half per strength. You see, when I move from problems, I'm coming straight to strength because we write them together. Allergies is half mark, irrespective of the number that you write, but it should be true to for the patient. Don't just go and write no known allergy when you have not even asked the patient. Then routine cares, the whole of this place is also half a mark. So here there are 9 items to be filled. Sorry, it's half a mark. If it is half a mark and there are 9 items and you forget to fill 5 of them, you get 0.